Hi, I'm Celestina Cavender and a certified birth doula here at Fernandez Hospitals. Today we're going to be talking about movement, mobility and positions. Here we'll be covering walking, rhythmic walk, standing lunges, kneeling lunges, open knee chest position, all fours positions, supported squat and the duck walk. Rhythmic walking. So when the mother does the rhythmic walk, the rhythmic shifts in shape of the pelvis which helps baby rotate and that helps the baby to descend down. So I'll let you watch the video. Here as you can see, the mother is behind the partner and they're walking and moving their feet in sync with each other. This helps the pelvis to also move. Standing lunge. When the mother is standing, so over here, she's widening the side of the pelvis towards which the woman lunges, usually done during her surges. Woman should slowly and rhythmically lunge sideways towards the chair. Woman should feel the stretch on the inner thigh towards the side of her lunges, and it also helps the baby to rotate if in OP position. So as we watch the video, the chair is against the wall. The mother has one foot on the chair facing 12 o'clock and the other foot facing 3 o'clock. Okay, the partner is holding on to the mother and you can see the mother is just moving her knees just to the side, giving a nice inner stretch. Okay, and remember, she does not go beyond her toes when she is doing the stretch. And make sure that when you do one foot, you turn around later on and do the next leg as well. As you can see, do not pass your knee beyond your toe. And you can see the inner stretch that's happening over here. So standing lunge, points to remember, never to be done by the women without support. The chair should be supported by the wall to prevent slipping. The knees should never cross the toes towards the side of the lunging. Leg is on the chair, should be completely placed on the chair to avoid any falling. Equal number of lunges to be done on both sides. Avoid if the baby is in breech. Woman has pelvic or pubic bone. Kneeling lunge. When a mother is leaning lunge, this helps to widen the sides of the pelvis towards which the woman is lunges. Usually done during surges. Woman should slowly and rhythmically lunge sideways towards the side. So, the woman should feel a stretch on the inner thigh side that she lunges. And this also helps the baby to rotate if in OP. So over here, as you can see, the mother is leaning down. She's doing her lunges. Okay, her foot again is at 9 o'clock. She's resting on, holding on to something, and she's just stretching her legs and moving it from side to side, making sure the knee doesn't go beyond the toes. Okay, but you can see the inner stretch that's happening. And make sure that once you do one side of the leg, make sure you do the other as well. Now the mother's knee must be painful, so use a pillow. Put a pillow under her knee while she's kneeling down. So the kneeling lunge, points to remember, never to be done by the woman without support. The knees should never cross the toes towards the side of the lunging. Equal number of lunges to be done on both sides. Use padded support below the knee if woman has knee or joint pains, and avoid if the baby is in breech and the woman has pelvic or pubic pain. Open knee chest position. In this position, the mother is just leaning on her knees and she's bending forward, resting on some cushions. But as you can see, her knees are apart and her feet are apart. and she's just resting down. That's all that's happening over here. The open knee chest position. Now, how does this benefit the mother? It eases her back pain, a nice even position for giving massages to the mother on her back. It helps the baby to rotate from an OP, which is occiput posterior position, to a occiput anterior position. It also benefits the mother with the open pelvic outlet, which helps the baby to descend down into the pelvis. Now, this is the pelvis. This up here is the inlet, and out here is the outlet. So the mother using this position helps the outlet to open, helps for the baby to descend down. The all-fours position. Over here, the mother is kneeling down on the floor. Okay, her knees are apart, her feet apart, and she's leaning forward, resting onto the birth ball. As you can see over here, what is she doing? She's leaning forward and just moving her body forward and backwards. Very relaxed, breathing with her surges as well. It's also helping her with gravity over here. If you don't have a birth ball, then use a chair. Now again, all the mother's doing is she's just kneeling on through the floor. Her knees are open, her feet are open, and she's just leaning and resting forward onto a chair. Now, what are the benefits again for all-fours position? Over here, it eases the back pain. Good position also to give the mother a back rub or back massage. Helps the baby to rotate from an OP position to an OA, from an occiput posterior position to an occiput anterior position. It also helps open the pelvic outlet and helps baby to descend down the pelvis. As we can know, this is the pelvic inlet and that's the pelvic outlet. So in this all-fours position, it just helps the outlet to open and helps the baby to descend. Supported squat. When the mother uses her supported squat, what happens? She actually lengthens her trunk, the back area, allows and gives more room for the baby to maneuver into position. Now again, it depends on each woman's comfort, okay, to decide how many squats she can do per day. Whether she wants to do a full squat, she wants to do a half squat, how long does she want to stay down in that position? This supported squat is to be avoided if the mother has any pubic pain, pelvic pain, or if the baby is in a breech position. Now, what is a breech position? Usually babies are in cephalic position with the head down. Sometimes the baby is in a breech position is when the baby's bottom is down into the pelvis, or sometimes even the feet are in that position. So that is a breech position. If you look at this picture over here, the first picture over here, here the mother is using a rebozo and her partner is also helping her to do a half squat. In the middle picture, what's happening over here, the partner is supporting the mother and the mother is able to do her half squat. And the third picture is the mother herself is holding onto the rebozo. She's got her feet apart, her knees apart, and because of that, she's able to give herself a half squat. In this video, what you're going to see is the mother is relaxed, breathing with her surges. She's also leaning against the wall and she's doing a semi-half squat where she is with her trunk. She's gone all the way down halfway. Her feet are apart, her knees are apart, and she's been able to go there, sit there for some time, and then lifts herself up. In this position, it also helps what? It helps with gravity. The mother is very comfortable when she's using this position. And the partner is also helping support the mother during the time the mother is doing these semi-half squats. And the mother just lifts herself up. Now this again, over here, the partner is giving the mother good support. Now the mother is on the opposite direction, her feet are apart, and in this position, she's holding on really tightly to the partner. Now over here, make sure you're not holding on to the tip of the fingers, get a good grip. Now the mother is the partner is actually taking all the weight and bringing the mother up in this position. And this way, the mother is sitting down for some time, making sure she can wait there and sit there for at least 2 to 3 seconds at her comfort. Then she gets up and she's pulled by the partner when she's coming into that up position. How many times you can do it is really up to the mother, how comfortable she is. Now, over here, what is happening? The partner is holding on to a rebozo, which is around the partner's back. The mother is having good grip onto the rebozo and is using the rebozo to lift herself up. So again, the mother's feet are apart, and because she's doing that, she's giving herself a nice full squat when she goes down. She stays there for a few seconds and comes back. Now, when she's lifting herself up, she's actually pulling onto the rebozo and letting the rebozo pull herself up. This takes advantage of gravity. Yeah, it also, what does it do? It widens the pelvic outlet. And all she's doing, she's just walking like a duck, with her 2 hands and her feet. Thank you.